There are more than 300 species of the aloe plant, but Aloe barbadensis, aka aloe vera, is the best known and is prized in the health and beauty worlds for its healing properties. The spiky, succulent plant grows naturally in dry, tropical climates in Africa, Asia, Europe, and the southern and western parts of the United States. Many centuries ago, people realized the plant had more to offer than just being nice to look at. The gel and juice found inside aloe vera became a popular herbal remedy that was used to help treat everything from skin issues to digestive problems. According to a past article and another article published in September 2019 in Sage Open Medicine. 2. Aloe vera has been known for its healing properties for at least 6,000 years. In the early days, the plant was known for being a plant of immortality, and was presented to Egyptian pharaohs as a funeral gift, according to the National Center for Complementary and Integrative Health. Over time, groups from many geographical areas have used aloe vera, including Indians, Chinese, Mexicans, and North Americans, too, research shows. Humans have long known about the plant's healing benefits, and over the years have used aloe, which is also known as burn plant, lily of the desert, and elephant's gall, to treat wounds, hair loss, hemorrhoids, and digestive issues. These days, aloe has an entire industry behind it. Its juices are used in cosmetics and personal care products such as moisturizer, soap, shaving cream, and suntan lotion. The aloe vera product that probably comes readily to mind is the bright green gel that's stocked on drugstore shelves. You've probably used it to soothe a nasty sunburn. Let's take a look at the history of aloe vera and its potential benefits. Aloe vera is also available in supplement form, which is purported to offer the same benefits to the skin and digestive system as other versions of the plant. There are two medicinally useful parts of the aloe vera plant. First, the leaves are filled with a clear gel. This gel is extracted from the plant and usually used on the skin to treat burns and various skin conditions. The gel is also marketed in liquid or capsule form to be taken orally. The second substance the plant produces is called aloe latex. This is the yellow pulp that's found just under the outer surface of the plant leaf. Aloe latex has been shown to have laxative properties, and it's usually taken orally to treat constipation. The latest in aloe vera trends is the introduction of aloe-based drinks, such as aloe vera juice and aloe vera water. The plant juices are usually mixed with citrus to make aloe vera juice or water to make aloe vera water. Aloe vera on its own can have a bitter taste, so many brands will add flavor or sweeteners to the bottle. Take a look at the bottle's ingredients to make sure it's not loaded with added sugar. There's not enough evidence to prove aloe vera can treat all the health issues it is said to help with. The claims are many and varied, including, aloe latex contains aloin, an anthraquinone that gives aloe vera its laxative properties, and which may relieve constipation. According to the National Institute of Environmental Health Sciences, constipation is a symptom commonly seen in primary care patients and also occurs with chronic digestive conditions like irritable bowel syndrome. An analysis of 3 randomized controlled studies published in October 2018 in the Journal of Neurogastroenterology and Motility suggests that aloe vera may be useful for individuals with constipation, including those dealing with this symptom in IBS. This is due to aloe vera's laxative effect and its ability to increase water in the intestinal lumen. Aloe creams have a calming effect on the skin and have been shown to help reduce itchiness and inflammation. In a past review of aloe vera, researchers noted the plant has the ability to inhibit prostaglandin E2 production. These are lipids that not only play a role in the inflammatory process, they're also active in the sebaceous glands, possibly contributing to inflammatory skin conditions, notes other past research. Some people swear by aloe to calm a sunburn. You might have experienced the gel's cooling effect yourself, and according to the Skin Cancer Foundation, aloe vera is generally safe to use for soothing mild sunburns. But the research backing up the claim that it can speed skin recovery is lacking. One past small study, for instance, found aloe vera applied topically after laboratory-induced sunburn didn't have an effect on reducing redness when compared with a placebo. Although aloe vera might not be effective for treating sunburns, it may provide some relief after a first or second-degree burn. In a review of 4 controlled clinical trials consisting of 371 sunburn patients, researchers found that healing times for patients who applied aloe vera to their burns was about 9 days shorter than in the control group. In a pilot trial published in December 2015 in the Journal of Traditional Chinese Medicine, researchers found that a standardized aloe vera extract in a syrup helped lessen several symptoms of gastroesophageal reflux disease including heartburn, belching, and vomiting, over a 4-week period. This may be due to GERDs linked to inflammation. Aloe vera has anti-inflammatory properties, as well as antioxidant and anti-ulcer properties that have been studied some in animals in patients with IBD. Irritable bowel disease, as past research notes a past clinical trial found drinking 2 tablespoons of aloe vera juice every day for 2 weeks helped lower the blood sugar levels among people with type 2 diabetes. Triglyceride levels of the study participants also improved, which could have additional benefit for those with diabetes. They're at an increased risk of developing heart disease, which is linked to triglyceride and cholesterol abnormalities. By now you may want to explore some of the potential benefits outlined above. It's best to do so in consultation with your primary doctor, nutritionist, or another healthcare provider who knows how to safely use aloe, especially if you want to try it internally. The plant has been shown to have a few other surprising uses, including a way to keep produce fresh. One study published in March 2014 in the International Journal of Tropical and Subtropical Horticulture found aloe vera gel applied on the outside of tomatoes helped delay ripening, aided in maintaining their quality and freshness, and prevented certain bacteria from growing. A mouthwash. Aloe vera mouthwash has been shown to reduce plaque formation on teeth in the short term, according to previous research. In the study, 300 subjects were assigned to rinse their mouths with either aloe vera mouthwash, normal saline, or chlorhexidine gluconate mouthwash. Researchers found that after 4 days, aloe vera was just as effective with reducing plaque as chlorhexidine and caused no side effects. More studies would be needed to assess the longer-term EF as a pain reliever. Salicylic acid, found naturally in aloe vera, is a compound that gives aspirin its anti-inflammatory effects. More studies are needed to explore the effectiveness of aloe vera in treating pain, but one past paper suggests that oral aloe vera may help reduce chronic pain that is not related to cancer, such as pain in individuals managing osteoarthritis. Meanwhile, other past research in mice suggests that a small amount of aloe vera applied topically may inhibit inflammation from mild irritants, though more studies in humans are needed. Aloe vera is also an IT ingredient in the beauty and cosmetics world. You'll find it in everything from moisturizers and toners to shampoos and deep conditioners. There's even an entire line of products called Aloe Vesta, which are designed to protect sensitive skin. What's the reason for the hype? The plant is known for supporting skin hydration and clarity. It's rich in antioxidants such as vitamin A, vitamin C, and vitamin E, and it contains 7 of the 8 essential amino acids. 1. It's also known for its anti-inflammatory properties, though some critics say more research is needed before we can say that for sure. A small, previous randomized trial of 60 people found that aloe vera topical gel helped treat acne lesions when combined with a tretinoin cream. Another past uncontrolled study found aloe has anti-aging potential. The researchers gave 30 women doses of aloe vera gel orally twice a day for 3 months. The women saw significant improvements in their wrinkles and the elasticity of their skin. It was postulated to be potentially from an increase in collagen production. You'll also find hair care products containing aloe vera. According to the website Birdie, some beauty pros apply the gel found inside the leaves directly to their hair and use it as a deep conditioner. It can leave a residue behind though, so be sure to rinse it out thoroughly, and if you have skin conditions, it's best to seek help from a dermatologist before putting raw plant products on your skin. Aloe gel, the part of the plant that's commonly found in creams and moisturizers, is generally safe to use and can be helpful in healing the skin when it's applied topically. Aloe latex, however, can be dangerous. Taking aloe latex orally can lead to cramps and diarrhea, and it could make other oral medications you're taking less effective. Aloe latex can lead to more serious problems, too. Taking even just 1 gram orally per day for several days could end up causing kidney damage and may even be fatal. It also can lower blood glucose levels, so people with type 2 diabetes need to be careful and talk to their doctor before incorporating aloe latex into their care regimen. Another potential negative for aloe latex: it could have cancer-promoting effects. A study from the National Toxicology Program found whole-leaf aloe vera extract created cancerous tumors within the large intestines of rats. But don't be alarmed. The study didn't involve humans, and the National Institute of Environmental Health Sciences says there's nothing currently in the literature that suggests researchers would find the same results in humans. The good news is, the rats in the study drank water containing 60 parts per million, ppm, of aloe every day. That's much higher than the 10 ppm that the industry tends to set as their limit, so it's not likely that you'd reach unsafe levels. Consult the label on your aloe vera product to learn about the best storage method. Generally, it's best to store aloe vera gel and aloe vera juice in a cool, not too humid environment, such as at room temperature or in the refrigerator. Humidity and temperature can affect the shelf life of the product. That's why you'll likely find aloe vera juice in amber-colored bottles. The dark bottle, according to past research, is designed to keep light from affecting the active ingredients. Aloe vera is considered a supplement, and supplements are not regulated fully by the U.S. Food and Drug Administration. That means there's no way to know for sure whether the quality, safety, or claims on the product are valid. And there are loads of products that claim to be rich in aloe vera, but many of them contain no or hardly any active ingredients. There is one thing to look for, however, when buying your product: the seal from the International Aloe Science Council, which is an organization that's been active since the 1980s. Their seal on a product means the product's aloe vera quality and purity has been tested and confirmed. Good news for non-green thumbs. Aloe vera is a cinch to grow at home. It's a succulent plant that prefers dry, warm climates, so it doesn't need to be watered every day. A little neglect in watering isn't going to hurt it. In fact, it may actually help, because this drought-loving plant lives best in dry conditions. You should be careful not to overwater the plant. And if you keep the plant outdoors, be sure to cover it when it rains. Aloe vera plants, which grow to be 1 to 2 feet high and up to 1 foot wide, grow best in tropical climates. Unless you live in Hawaii, Southern California, or Southern Florida, you won't be able to leave it outdoors all year. But you can easily leave it in a pot and bring it inside when the temperature drops. Ideally anytime it gets close to 50 degrees Fahrenheit or cooler. Sunlight is key to a healthy aloe vera plant, so position it outside in a sunny spot or inside on a windowsill. When planting your aloe vera plant in a pot, choose a shallow, wide bowl so the roots have room to move and spread as they grow. New seeds will grow around the base of the plant, which you can then take and plant in a new pot.